Hepatobiliary immunodiacetic acid scintigraphy is a diagnostic nuclear medicine procedure. For this procedure, we use a specific radiotracer, technetium immunodiacetic acid. So to explain how this method works, we have to recall physiology. Recall that the normal components of the bile are water, bile acids, phospholipids, conjugated bilirubin, and cholesterol. Once bile is produced by the liver, bile through the bile ducts income to the gallbladder. And the gallbladder is the place where bile is stored until we consume some fatty food. Basically, the only function of the gallbladder is to store bile and to reabsorb water from the bile during the storage. After gallbladder pushes bile into the cystic duct, through the cystic duct bile income to the common bile duct, then bile passes through the Sphincter Oddi into the intestine. In the intestine, some portion of bile undergo reabsorption, and some substances are simply excreted from the organism with the feces. Now, we infuse into the vein a radiotracer, which is technetium immunodiacetic acid. Immunodiacetic acid has the same pathway as bilirubin. So initially by the blood, radiotracer is delivered to hepatocytes. Then hepatocytes secrete immunodiacetic acid into the bile. Immunodiacetic acid with the bile initially goes through the bile ducts and cystic duct into the gallbladder. In the gallbladder, together with the bile, immunodiacetic acid is stored for some time. And when gallbladder pushes bile, with the bile, immunodiacetic acid goes into the cystic duct and then into the common bile duct. And then together with the bile, immunodiacetic acid crosses Sphincter Oddi and then we excrete it with the feces. All this procedure we monitor under the scanning camera. The scanning camera has one specific feature. It is very sensitive to radioactive substances as isotopes, even if radioactive activity is minimal. And because immunodiacetic acid is in complex with technetium, scanning cameras can trace the entire pathway of immunodiacetic acid through the biliary tree. So when we look at image provided by the scanning camera, we can see only the pathway of immunodiacetic acid, simply because this acid is binded to radioactive technetium. But because immunodiacetic acid is excreted with the bile, it has the same pathway as bile, and thereby, through the immunodiacetic acid, we can trace the movement of bile through the biliary system. So, as we see here, once bile is formed in hepatocyte, hepatocytes excrete bile into the biliary ducts. Then bile goes into the cystic duct and the gallbladder. In the gallbladder, bile accumulates and then gallbladder pushes bile into the common bile duct. Then bile crosses Sphincter Oddi and excreted with the feces. Here is an example how it's look like in real life. So here are hepatic ducts, then bile goes through the biliary ducts into the cystic duct and into the gallbladder. Then gallbladder pushes bile into the cystic duct and common bile duct, and then bile enters into the intestine. So if everything works fine, we have to see at least gallbladder, common bile duct, and the passage into the intestine. For example, here we can definitely see gallbladder, we can see common bile duct, and we can see the passage of bile into the intestine, which is perfectly normal. But in some disorders, biliary pathway becomes disrupted, and the most common reason is acute cholecystitis. In acute cholecystitis, stone becomes stuck in the cystic duct. With obstruction, the passage of bile into the gallbladder becomes impossible, and because of this, immunodiacetic acid cannot enter into the gallbladder. So now, as we look on scintigraphy, we can see that bile goes from the hepatocyte into the biliary ducts, then into the common bile duct, and then through the Sphincter Oddi into the intestine. But what we do not see is any traces of immunodiacetic acid, and thereby of bile in the gallbladder. And the reason, as we know, is the stone that cause an obstruction of the cystic duct. So if everything normal, we can see the entire biliary pathway, with the bile ducts, gallbladder, common bile duct, and intestine. But if stone cause obstruction of the cystic duct, bile cannot pass into the gallbladder. As a result, immunodiacetic acid cannot enter into the gallbladder, and without immunodiacetic acid, we cannot see gallbladder on a scan. And a state when we cannot see gallbladder, but common bile duct and intestine are visible, is highly suggestive of a stone that cause obstruction of the cystic duct, and this condition we call acute cholecystitis. Here is another example. So it's a normal scan with entire biliary tract visible, and on this scan we can see common bile duct, also we can see intestine, but we cannot find here anything that resembles gallbladder. And because of this, we can suggest that most probably we cannot see gallbladder because of obstruction of the cystic duct, which is most commonly caused by a stone in acute cholecystitis. So absence of the gallbladder on a scan is highly suggestive of calculous acute cholecystitis. Another pathological state that can affect biliary tree is dysfunction of the sphincter of Oddi. So if sphincter of Oddi remains contracted, bile cannot pass into the intestine. As a result, on a scan, we won't see radiotracer in the intestine. So here are hepatic ducts, then bile goes through the biliary ducts and cystic duct into the gallbladder, then gallbladder pushes bile into the cystic duct and common bile duct, and then bile enters into the intestine. With dysfunction of the sphincter of Oddi, bile cannot pass into the intestine. As a result, we won't see intestinal filling, so intestine on a scan won't be as visualized as it should be. Another pathology is severe liver injury that causes severe hepatic dysfunction. With severe liver injury, hepatocytes cannot uptake substances from the blood, so liver uptake of immunodiacetic acid becomes disrupted. As a result, liver cannot form bile that will have normal composition, and without it, there will be no filling of biliary tract. So here is the normal bile pathway. If damage to the liver tissue occurs, liver uptake becomes disrupted. As a result, liver cannot excrete into the bile radiotracer, and without radiotracer, biliary tree won't be as visualized as it should be. It's a real-life example of a scan in a patient with severe liver dysfunction. As we see, there is no biliary tract filling, we do not see gallbladder, we do not see common bile duct, and we do not see intestine, which is most probably tell us about severe hepatic dysfunction. And last but not least, this method is perfectly safe. The only contraindication is anaphylactic reactions to radiotracer. All these features make hepatobiliary scintigraphy the most accurate method in diagnosis of acute cholecystitis.